adding 2 more trainers to the roster.
Okay, that's good. I'm gonna push these guys off for tomorrow. Hopefully they'll go tomorrow. I gotta, you know. It's not over anyways. They're doing dispatch here tonight. It's not.
Okay, sounds good.
All right, all right.
How are you guys doing? How's everything?
Well, my blood pressure is up probably 20 points.
Don't worry. Okay, hold on 1 second. Let me just add this. Sorry, I apologize.
So you have to review your just you have to be in automated so much. Recently or back in back when we started test?
Okay, let me pull up. I don't want to give you double scenarios, so let me pull up what we did. Yona, oh, you're already. A question for you.
Yes.
On the boxes of the SL radios.
Yes.
It said 33051-234. Okay, one of those. 33051 or 33052 or 33053. I didn't see that in none of the code plugs and none of the none of the original code plugs. None of them had those numbers. And on top of that, it says searching.
Oh, that's the slim.
Yeah.
Oh, the slim. I didn't even touch the slims, so I don't know.
Those aren't working even on their programming.
Really?
So I was just wondering if nobody touched it, that means that the problem is by them. I'm sure they messed up with the numbers. So that's fine.
I didn't touch those. I didn't touch those yet.
Okay, not a problem. I'll send it to Justin. He'll take care of that. That's not a problem. I just wasn't sure if I don't know. I thought maybe I was missing some information, but I just recognized. I was trying to figure out why it wasn't working, and only now did I realize we were working on it earlier. And I asked to take a look at the box, and it says a different number on the box. So there was a mismatch in information, but whatever. Okay, let's get to what we needed to do. Members. Here we go. Okay. Who wants to start? Chaim, you want to start? You'll be the responder, okay? So if you can step out for a minute.
Actually, the door goes off here. Sure. Sorry.
Okay.
All right. Close the door.
Yona, you remember what I gave you? What I gave you to act out yesterday? Or no, I'm sorry. What you had yesterday? You had the. Let's. I'm looking at
the elderly gentleman that had surgery and he was going up
yeah. Okay, that's what I'm gonna give him that one.
Okay.
I'm gonna give him that one. Okay, so I want you to be slumped over, look kind of like this on the side. You're going to be taking your time with responding to him, right?
So
close your eyes. Yeah, deep. Not slow on the faster, but deep. And also close your eyes even most of the time. Okay, if he asks you a question, take forever to answer and answer it by one word.
Okay.
Okay. Okay. Now, I might end it by telling you if I go like this, I want you to be totally unconscious. Basically, you're unconscious, and I want to see how he responds.
Okay, pass out.
You're out. Yeah. When I go like that, I'm going to be ending it with that also.
Okay.
Do you by any there's no dummies there, right? Any Annies?
No.
Okay, no problem. Does he have his equipment?
Yeah. Chaim?
Yeah,
Is that your bag?
yeah.
Okay, yes.
Let's go.
Yes.
Hi, I'm from Detroit, Solo. My name's Chaim. What seems to be a problem? Okay, so I see I have a middle-aged male who looks like to be unresponsive.
Chaim, you're dispatched to an 83-year-old not feeling well.
Oh, he's 83.
Yeah.
Okay, not feeling well. Okay. Okay. So what am I seeing? Is my scene safe?
Your scene is safe. He's in his house. His wife opens the door, and she shows you to him. He's on the couch, as you see him right now. He's a little bit more slumped to the right, a little bit more.
Yeah.
Yeah. Okay. Exactly. That's how he's slumped over. That's how you find him.
What am I seeing in terms of oxygen, medication?
No, you see on
Water?
no medication, but you do see on his arm. You see like a bandage, a medical bandage that's kind of around, and a port, what we call a port, a central line from his arm.
Okay, it's exposed? Is his arm exposed?
It is exposed, but it's the bandage that you can't, meaning it's secure.
Okay, sir, can you hear me? I'm gonna help you. My name's Chaim. What's your name? So he's responsive to sound. What's your name? Oh, he's having trouble speaking. Is his wife here to answer some questions? Is his wife going to answer questions? You'll be his wife.
Yes, the wife is there, able to answer. She tells you that he was in the hospital last week. He was there till yesterday. He went to the hospital because he was vomiting blood. He had 6 years ago pancreatic cancer, and yesterday when he came home, he was fine. He was walking, everything was okay. Today he just wasn't waking up. He was taking forever, and he just got worse and worse.
Okay, all right. I'm just feeling for a pulse. He's obviously breathing. I can hear him breathe. I'm hearing some gurgling sounds. We pull the pulse ox on.
Okay, it's not gurgly. It's more deep breathing.
Deep breathing.
Deep, yeah, kind of like half of a snore, kind of. And his pulse. You said you're checking his pulse, just getting an approximate. It is going to be irregular, and it's going to be around. It's not super fast, but it's on the fast side.
Okay, okay. And how is his airway? He was able to make some sounds for me. It looks like he's bringing some air in and out. His pulse ox, at least his pulse ox, is 97. What is the patient's?
The patient's pulse ox is going to be 96.
96. Okay, good cap refill. And his skin condition?
It's going to be pale.
Okay. Well, he's not making any sounds anymore. What is his breathing rate?
His breathing rate is going to be 26.
Oh, still 26. Okay. So he's getting enough oxygen. The breathing concerns me, though. You're doing a fine job of acting this out. Irregular breathing. Is it irregular, or is it just? It seems like it's shallow.
He has an irregular pulse, not the breathing. The breathing is regular.
Okay. It sounds like he might be having some type of renal failure. I mean, if he has a shunt, I'm assuming that he's a person with poor kidney function. I'm going to call for immediate ALS backup and priority transport.
Okay, do that. How do you do that?
Well, I'm going to use my radio. whatever I have. I just have a phone
Yeah,
here.
your radio. You're on your radio. Yeah.
Right.
What do you say?
So I'm calling, I don't know what the protocol is. I think it's 31 to base.
Right.
I
Yeah.
have an 83-year-old male who has an extensive medical history.
Yeah.
With a port shunt. Yes.
Fine. You don't need to say the whole thing. You're requesting ALS.
Okay, requesting ALS for
Why are
meter
you requesting ALS in one word?
One word.
Yeah.
Uh,
You're requesting ALS on what? What's bothering you right now?
his breathing, respiratory
Okay,
distress, irregular heartbeat,
Okay, so
respiratory distress.
good. M, I don't know your number, but whatever, to H base. Okay, and whatever, go ahead.
Right.
And dispatch will respond to you. Go ahead. You'll say, requesting ALS for a patient with difficulty breathing.
Okay.
That's it.
All right. So we've never done that before, but that's.
I know,
good.
and that's why I'm adding it now.
Okay.
What else?
So,
What? Okay, so if he has difficulty breathing, what do you want to do?
well, he seems to have good perfusion, but I would still try and help him out with some oxygen.
Okay.
Actually, what I would do is I would have him sit up, if I could. If there were pillows here, I would prop him up a little bit.
Okay, good.
Give him a more comfortable position instead of hanging over.
Okay. Yeah. Okay. Continue.
Yes. Okay. So if he can't hold himself up, then he's going to have to be back.
Okay.
I would make sure that he has no restrictions. I mean, no physical restrictions in order to be able to breathe normally.
Okay.
So he does have some responsiveness issues. Level of consciousness level of responsiveness really is not ideal. Does he have any medical assist bracelets or necklaces? Anything that would tell me besides his cancer history is really not something that I have any. I can't do anything with that information.
Continue. Let's continue with what you can do. First of all, treatment. You said you would give him oxygen.
All right. So at this point, a secondary assessment. I would start my secondary assessment. I would listen to lung sounds. I would take his vitals, which would include his actual pulse rate and his blood pressure. Want me to take it now?
Yes, please. By the way, do you still have that oxygen mask opened that I asked you to keep?
Yes, I do.
Okay. I want you to give him oxygen as well. Just.
I would do that first, because that would be part of my primary, or actually part of airway, airway and ventilation.
Mm-hmm.
I had one open already. So.
That's the open one, yeah?
Yes.
Good. Amazing. I think what I'm going to ask you to do is to leave the open mask in HQ, because they're going to be doing a lot of training there. I don't want them to keep on opening new ones, so I think that one that is open, just saying that side note. Continue.
All right, so I'm just filled an army breather mask. So in this case, actually, since he is perfusing, I'm not sure if the 9 breather is, I mean, it can't hurt, but a nasal cannula would probably be sufficient.
Okay.
Okay. So
Okay.
at this point, I would continue with.
Yeah, you know you can take off the mask. Continue.
I agree. Okay, what's his blood pressure?
You can't hear it with the stethoscope.
I can't hear what the stethoscope. Too much background noise, you're saying?
Yep. How do you check it then? You don't need to move it, by the way.
Okay, so I could do just systolic.
Okay, and I want you to actually check it.
$140.
Okay. His blood pressure in the scenario is 40.
40.
40 systolic.
Okay. 40 systolic. So we would have to get him onto the floor and raise his legs because he's going into shock if he's not already there. He's probably in compensated shock. What?
All right.
So we would have to either get him
Do that.
off of the chair onto the floor.
Okay, so go ahead.
Or you're on the couch, we can just maneuver you. What's the temperature in the house?
It's normal.
Okay, so that's sufficient. We don't have to worry about.
You wanna, Yona? Do you mind lying on the floor? Or no. Tell me how you feel. I'm saying, do you mind if he would? Okay. How would you put him?
How would you get him? How would I get him on the floor?
Yeah.
Well, he's 83 years old. Okay, we didn't say it before, but obviously I don't suspect a C-spine issue.
No,
right?
no trauma. No trauma.
So if it were just me and he has already a blood pressure of 40, I would just take him like this. I would get into a lock back position.
Do that.
I don't hurt my back.
Go for it. Okay, very good. Yep.
And of course, I would control his head. You can't see from my arm, my forearm.
I do see it. I do see it. Very good. Very good. Very good.
If he hits the
Okay.
floor.
Okay. Yona, you see me, yeah?
Yep.
Okay, good. Continue.
Okay, so at this point, he's still on the action. I would take his blood pressure again to see if we've helped him in any way. I would take off his shoes and see if we have a pulse, a pedal pulse, because that will tell us. Actually, if you have a pedal pulse, what is your minimum blood pressure? 90?
Wait, you light him down on the floor, very good, but you're forgetting one step. I mean, you said it before. Yeah. How would you elevate it? How would you elevate it?
12 inches.
I'm saying, what can you use?
Oh, what can I use? A pillow?
Okay, that's one. Just by the way, you should know you could use, if you don't think you'll need your equipment, you can always put your equipment bag under it. But
I was going to say that if there's nothing around, I was going to say to use my bag.
okay, good. Okay, so you put a pillow under his feet. Great. Continue. Continue your
So at this point, I have to reassess. I would take his blood pressure again.
Go for it.
He doesn't look good. He doesn't
Right.
look like he's changed. He has changed. He's not breathing.
Correct. Okay, so now if he's not breathing, what would you do?
The first thing I would do is I would check for a carotid pulse.
Okay. And
A minimum of 5 seconds.
great. If you don't feel a pulse,
If you don't feel a pulse, then I would begin CPR.
great. How many compressions do you do?
A minimum of 100 to 120.
How many compressions, not the rate?
30 and 2.
Perfect. Okay.
So
EMS walks in. He has a pulse now. He got back a pulse. EMS walks in. Give me patient care.
Okay, is he breathing? Am I gagging him?
He is breathing.
Okay.
You can sit up now. Thank you.
I'm an 83-year-old male who was responsive to verbal to verbal stimuli. His blood pressure, when initially taken systolic, was 40, pulse was erratic, standing at 97. After we put him on the floor, he went into cardiac arrest and came back with CPR and breathing.
Okay. Did you yeah, Yona, you could add now. Yeah.
The same thing. I missed it too. He was throwing up blood.
Oh, okay.
Originally, why? No, why did he go to the hospital? You forgot the part about the hospital. It's critical to know that he just came back from the hospital and why he originally went to the hospital.
Okay, so he's going into hypovolemic shock.
That's one option. That's one option. Very good, by the way. That was one option. Is there another option that you can think of?
Well, he's lost fluid one way or another.
Right, either hypovolemic shock, that's one. What else?
Well, if he has kidney failure, I guess that might cause him to go into shock.
What can you get if somebody was throwing up, vomiting blood? Usually means that he was bleeding in his intestines, right?
Right.
And I mean stomach. Right now, what are one of the if somebody has some type of a GI issue? Can we think of something that might happen, especially in a hospital setting? Not even GI, but anybody.
I guess he could have developed some sepsis.
You got it. Okay,
Hospitals are great places to get MRSA. That can cause shock in and of itself.
Good.
Right? But would he not? I did check his skin temperature, right? I did check the skin. There was no indication of infection in that regard.
Okay, so thank you very much. You did a great job. You picked up on the diagnosis. You treated the things that needed to be treated. You recognized the critical conditions that he was in. If I may say just one piece of feedback, you could do it a little bit quicker. Meaning, when you saw that he had difficulty breathing, give him oxygen. You recognize that he wasn't breathing normally, right? It was a deep breathing. Even though his perfusion was fine, but there was something that was telling you that he was still in difficulty breathing. Give him oxygen. Then also try to figure out, by the time it took you to check the blood pressure, that could have been a little bit quicker. Why? Because it is a big indication to what's happening. What theoretically, again, work on different diagnosis, right? Differential diagnosis. What could be causing this status? He was also slumped a little bit to the side. And the reason why I did that is because I wanted to throw you off a little bit to think towards possible stroke maybe, right? Somebody who's having a stroke will be on the side like this. They'll always be moving to the side, okay? So if by checking the blood pressure, you would have had a better indication of how critical the patient is right now. Yes, he suffers from, you can ask also, I said it's an irregular pulse. One question that you could ask the wife, does he suffer from atrial fibrillation, which is an irregular heartbeat? And she would have said yes. Okay, meaning try to, you found something, it's irregular, ask, make sure, you want to verify that it's not something new. Because if it was something new and he had a blood pressure that low, I would have thought maybe even cardiogenic shock, right?
Right. But
in this scenario, it was chronic for him. Chronic atrial fibrillation, it's called, CAF. So what I'm trying to say is that getting to the blood pressure in a scenario like this is very, very important. So again, the initial assessment you could have done just a little bit quicker. It was good, you got it. I know you were going a little bit slow in order to tell me what you're doing, which is perfect. That's why I'm giving just as feedback. Go to it, don't wait. Very good.
Even though,
Yona, do you have anything to add?
yeah, even though usually blood pressure comes later in the secondary, but you're saying because of the circumstances here, you should see there's something there, so that should be part of the original, initial.
Exactly, because again, you want to try to rule out critical conditions. And again, even a CVA, you would want to know if he, you saw he wasn't responding to you. He was very slow to respond to you when you asked him a question. It was very slow. That, again, is kind of like, okay, that's my direction. Let's verify it. So you did the pulse right. You did it good. You gave the, you said he had, it seemed like difficulty breathing. You called ALS. Great. Now already, even at this point, I would have said, hey, you can even call ALS, meaning once he collapses, and if they're not there, you could advise that he's coding, that the patient is coding. Okay, because you want additional members to help you with CPR.
Great.
Any questions?
No, I just can't get enough of these.
That was very good.
You'll never get the same. You'll never get to. He had that call actually.
Yeah, I had that call 2 days ago on my
I
shift.
was waiting for it to be on the chat and didn't get around to it. You got busy.
I didn't get around to it because I thought it would be a good idea to use it in the assessment. And if I would have wrote it up, then I wouldn't have been able to use it. And I can tell you one thing: when I got there, and I'm with an ambulance, I do transport. I tried calling in the ICU, but they weren't. We had communications issues on that day, and I just brought him down to the ambulance. I started evacuating right away, transporting, and I called it into the hospital beforehand. They were ready for me because the patient was crashing on me. He didn't go into a code, but he was crashing. Yeah, so we did exactly what you did. We elevated his legs. We even pushed fluids, which that we can do, you cannot. And when we got to the hospital, he was still stable at that. We brought him stable with the same condition we found him in. Yeah. Okay, Yona, you ready? Okay, Chaim. Okay, let me give you what you need to do. Okay, I'm gonna do. You're a 65-year-old. You came back from a run. You had difficulty breathing while running. You felt like your heart was pounding. It still hurts you, but it got better. And again, I'll go like that. You'll know basically, oh, it's starting to hurt more. Okay, when it was hurting you originally, you were running, you sat down, it passed after a while, and that was, let's say, 2 hours ago. Okay. No medical history. If he asked, your father had, if he asked, your father had medical history of cardiac issues. Okay?
Okay.
Okay, call him in.
Okay. What do we have?
We dispatched a 65-year-old Difficulty breathing.
Okay. Hi, Yoel. Hi. What's the problem?
No, he's fine. Chaim, Chaim, you're okay with breathing now.
I'm okay now? No, but you said difficulty breathing, so he comes in, he's not gonna
No, Chaim, that's the idea. It got
Right.
dispatched as difficulty breathing.
Right. So
I don't know, I was out for a run, I started not feeling well, my chest was hurting me, so.
is it still hurting?
No, it's better now.
How long ago was the run?
It was about 2 hours ago.
What kind of feeling did you have in your chest?
I don't know, just crushing the feeling.
Did you ever have that before?
No.
And you're breathing okay?
Well, when I had the pain, it was difficult to breathe.
Okay.
Pain.
And it went away now?
It went away.
Okay, when was the last time you had a drink?
Just when I came home, very thirsty.
How much did you drink?
Just an ounce of Jack Daniels.
Okay. Okay. So let's see. So now we can go to. We don't have anything active now, but we can see what is his pulse rate and his respiratory rate.
His pulse is going to be 128, and his respiratory rate is 22.
Okay, high pulse rate. And skin condition?
Right now, it's fine. A little bit on the red side.
Okay.
Just a tad. Not very red. Just a little bit.
Okay. So he's breathing okay. His heart rate is up. You started feeling it as you were running or afterwards?
As I was running.
As you were running?
I sat down to take a break.
Okay, and you never had this episode before?
No.
You don't have any, so there's no point in giving aspirin or asking him if he has, nitro. Did you ever take nitro? He never had the condition, he doesn't even know what it is.
Nitro? What is it?
He doesn't know, right? Aspirin, there's no point. Okay. It's back. It's back, okay. Let me lie you down just for comfort. Okay, and then I want to, how's it breathing? How's his breathing?
No, his breathing is okay. Just it's labored a little bit because he's
Okay.
asking what's bothering him. I'm saying,
What does it hurt? He said crushing pain.
Right here.
Right in the center. It's only there. Okay, take a deep breath. Does it hurt?
Yes.
It hurts when you breathe deep?
Yeah. Yes.
Okay. And if you stretch.
it doesn't hurt him. It doesn't hurt him when it hurts the same.
No change. Okay. No change when you.
No instruction.
Okay.
I'm winging it.
I'll ask you.
I'm winging it, dude.
Okay. So there's no change when you breathe deep. Okay.
No.
Okay, I'd like to lie you down for more comfort. Okay?
Okay.
Pretend he's lying down.
On the table.
Okay, at this point, we're way up to here. I would take his blood pressure now and see where we're up to. Thank you. Okay, what is his blood pressure?
The blood pressure of the patient is going to be, 130/90.
Okay, he's actually 120 over 80. It's not bad.
I was very close.
He's a runner. Okay. You said it's
130.
130 over 90.
Yep.
Ooh. Nice. I would give him aspirin to see if that makes any change. That's gonna be pressure. Okay.
What?
If I do give him
No,
aspirin, do you have any allergies to aspirin? Do you have any allergies? And do you have any surgeries in the past couple of weeks? No? Okay. And you have aspirin at home? Someone?
Yeah, he has aspirin in the house.
Okay, so we can give him
He has baby aspirin.
what? Baby aspirin? Baby aspirin, I'll give him 4 of them. Okay, 4 baby aspirin. Just chew it. Chew it before you swallow it. Okay. Did that make any change, or did I notice any change from that?
No, no change. No change.
No change. It's still painful.
Yep.
Still painful. Okay. Next. Stress. What? Pain's not muscular. Well, do you feel pain anywhere else?
It's radiating a little bit to his arm.
It's radiating. Oh,
It's
so
Now it's radiating also to his arm.
okay, I'm calling for ALS. Okay, H-base, this is M20.
Go ahead, M20.
Requesting ALS for possible for pain chest or possible cardiac. How do you?
Chest pain.
Chest pain. Okay. He's lying down. His legs are up, and well, yeah.
Okay, EMS shows up.
Okay. We have a 65-year-old male that just was jogging, no history, has an episode of chest pain an hour after jogging. Did you eat anything?
I had breakfast.
You had breakfast. After you ran, you had breakfast?
No, before.
Before you ran, you had breakfast. Okay. And it went away, and then it came back, and it's slightly radiating on his arm.
Okay. So let's go over. First of all, what do you suspect here? What's your diagnosis?
Okay. I was going to look at indigestion at this point, but because he ate breakfast right after running.
Before.
Before possible angina.
Okay.
Because of the running. First I was thinking dehydration, but he said he was hydrated.
I understood that, yeah. Mm-hmm.
What else? Could I eliminate?
Let's review it. First of all, how do we assess a patient, right? What questions do we ask? Do we have any type of flow, that we go by? Any type of
Yeah, right. PQRST.
Oh, OPQRST. What else? Another.
Right.
Okay. You were missing the sample and OPQRST, and I'll tell you why. Let's do it together now. Okay. Sample. Okay. You can ask, what do I see? What are the signs that I see, right? Because signs is something that you see. Okay. Asking, first of all, you asked when you came in, very good, you did that. When he started with the chest pain, okay, he's also sweating. I should probably, that was my fault, I should have said sweating, okay, but that's fine, okay. Allergies, right? A for allergies, if all types of allergies. M. What is M? Medication, right? You asked. And
Uh,
okay, what's P? Well, it also goes into P. What is P?
previous, we did that, previous.
Previous medical history, right. Previous medical history is not only the patient, especially when you're talking about a patient that is complaining of chest pain. You also have to ask family medical history, meaning parents. Because a lot of times, if a parent had cardiac issues at a young age, that can go over to the children. Okay? Next, last oral intake, you did great. E-examination, that's, you continued. Great, we did sample. Perfect. Then he started complaining again of chest pain. What we go by OPQRST by chest pain. You did half of them. You did half of them, but you missed the other half. Meaning, the onset you knew that he was running initially. So there you have an onset. Okay. Provocation. You asked if if he changed. Great, you did that. Then severity. I mean quality. Quality first. What type of pain? You didn't ask him.
Okay.
Right. What type of pain is very important. Then severity. On a scale from 1 to 10, how much does it hurt? You want to know how severe is it? Okay, because if he says that it's right now a 10, right, that's usually an indication more towards a possible heart attack, a possible MI. Okay, then we did ST. How long, right? Did you ask him how long ago he was running?
Yeah, he said an hour ago. 2 hours ago.
And now he's starting again, chest pain. Then it was very possible that it was angina or just the beginning of a heart attack. But now if he's complaining again, that means right now that you have a current issue. Okay? So it was good you went with the aspirin. Very good. But if I may add one thing, they're not supposed to swallow it. After they chew it, leave it under their tongue. Yeah. Because I think it's called bilingual, right?
No, that's sublingual.
Sublingual, sorry. Sublingual, yes. Sublingual is the quickest way. What?
You're bilingual.
Yes, I'm bilingual. Thank you. Sublingual is so it absorbs much quicker.
Okay.
Right. So you ask him to chew it and leave it under his tongue. Okay. Small tip: when giving a patient aspirin, if they have any type of like heartburn or acid reflux or any type of upper GI issues, not ulcers, because again, if it's an ulcer, we don't give it. But if it's not an ulcer, we could give it. Just have in mind he might feel like he has to throw up. So if he all of a sudden starts like, gagging or something like that, don't be alarmed by it. Okay? Just
under the tongue?
No, I'm saying after usually people do swallow it eventually. Okay? So it's good, and even if it's under the tongue, it might cause the stomach to be a little bit upset. There are people that are a little bit more what's the word? Sensitive. Thank you. They're a little bit more sensitive to it. So just have in mind they might gag and feel like they have to throw up. So bring a bag and give them that they could vomit into the bag. Now that was in regards to the aspirin, but it was good that you thought about that to give it to him. Again, best to do OPQRST. You did the differential diagnosis, which was very good. You did do that. The last thing that I would say is why lay him down?
Yeah, because that's right, his blood pressure was fine,
Yeah.
pretty much.
Lay down. The only time you should lay down a patient, there's only one time, which
Shock.
we exactly dehydration, shock, low blood pressure, hypotension.
Oh,
Yeah, hypotension, low blood pressure. That's the only time where we should lay a patient down if he's not lying down already. Okay. But other than that, it was good. It was definitely, you did well. Try to have those things in mind in regards to the way of you do have a protocol, we could call it, for assessing a patient. Yes, there is a method. Yeah, you start off ABC, but that takes 2 seconds because when asking one question, you already got A and B. So see, right when you come to the patient, another thing, right when you come and start talking to him, put your hand on his pulse, get the assessment of it, right? So ABC, that takes literally 10 seconds, not more. And then you could already go into sample, OPQRST, and then based on what you're getting from it, for example, if it's a possible stroke, then you have to do the Cincinnati test. Meaning you have methods to guide you. I believe I sent out what Leon sent me on the group of the Hatzel Detroit. I believe I sent out a flow chart. So if not, I'll send it to you personally. I'll send it to you guys that you should have it. It's not, it's good to read over to see it since it really does have a good, you have what to work with.
right.
Here, I'll send it to you right now. One, and wait, I'll get the other one too. And 2.
Great, thanks.
I sent it to your phone, Yona. Chaim, I'll send it to you as well. It'll be easier from my phone to send it to you. Okay. Any questions?
That was pretty good. What was it really? It was
He went running and he had angina, but it was a passing heart attack. Because in actuality, it came back and it was worse this time to a point where it was blocked.
So you would do transport on that?
Oh, 100%. He would probably go to the cath lab.
Okay.
Okay, meaning somebody who complained of what sounds like a heart attack and never had it before, it's very possible he did have a heart attack, a small one, and it passed. Okay, don't forget, what is a heart attack? It's when there's a block, right? And he was running, so it was like, because he's running, the blood vessels constrict, okay? And also there, same idea, the heart is working more. So what happened then was he had a clot. It wasn't a clot, it was a blockage due to the running. But then he usually, a patient like that, if it would happen again, he would get nitroglycerin and then it would pass. Meaning patients like that, they already know that they suffer from angina, but that's also after a cath lab. They do all those things. In this scenario, because it was new for him, he never had it before, it sounds more like that was the beginning and now it just came full out. So you could say, yes, when you called ALS, that's good. You called ALS for chest pain, okay? That, no problem. You can even the terminology is ACS. The medical terminology is ACS for acute coronary syndrome. ACS, acute coronary syndrome. Okay, but then again, that doesn't say a lot. It's but usually it's an MI, a myocardial infarction. But that's, you don't even really, the truth is you can say, just like you did, H-base, M20 to H-base, go ahead. I am requesting ALS for chest pain on location. Okay, that's it. Usually you can even add in the age. Sometime that, you know, it doesn't matter. 65-year-old with chest pain. That's it. And then they'll let EMS know that they need an ALS bus.
All right.
That's it. You did well.
Well, thank you.
My pleasure.
You know, are you involved in Tel Aviv, the music thing they have, festival, whatever?
The what?
Tel Aviv, they're having a big music thing. You involved with that? No. Okay. No, I don't get involved with the music. I mean, with Zach, what do you call it?
Hansala. I don't even know what they have there. The truth is, I don't go to that area. I really don't.
Okay. Good.
It's just, I also have a car, and it's annoying. Tel Aviv is it's worse in Tel Aviv than Manhattan.
Oh.
Meaning, there's no parking spots. It's not, and it's just. I personally, I do not like going to Tel Aviv. I take Yerushalayim any day over that.
Wow. Okay.
Yeah. Anyways, it was a pleasure. Thank you.
Thank you very much.
Good night. Thank you. Okay.
Bye bye. Kultiv. Oh, leave the mask. Yona, if you could put the mask somewhere and just let everybody know that there's an open oxygen mask to be used for training, and let everybody know where it is.
Okay, great.
Thank you very much.
Thank you.
Thank you.
Kultiv. Bye bye.